brief introduction. Lyme disease is the most common vector-borne disease in the United States. It's an illness caused by Borrelia bacteria. Humans usually get Lyme disease from a bite of a tick carrying this bacteria. And you're at risk of Lyme disease if if you spend a lot of time in a place where ticks live, such as grassy, bushy, or woody areas, if you like to camp or maybe hike. And if it's not treated early, this infection disease can spread to your joints, heart, and nervous system. And ticks are very hard to see. Sometimes they're very small, about the size of a poppy seed. So they may be difficult to spot. So here on your right, you see like where you should check for ticks if you've been out in an area where they can live. So for etiology, Lyme disease Borrelia are obligately parasitic, tick-transmitted, persistent bacterial pathogens that cause the disease in humans primarily through the induction of inflammation. During transmission from the infected tick, the bacteria undergo significant amount of changes in their gene expression, which allows them to adapt to the host environment or the mammal or the human environment. And then this organism multiplies and spreads locally and it induces inflammation responses that in humans result in clinical signs and symptoms that Elizabeth will touch on later on. So for the transmission, the Lyme disease bacteria causing human infection in the United States, Borrelia burgdorferi, or sometimes rarely seen B. mayoni, are spread to people through the bites of infected ticks, like I said before. So Borrelia burgdorferi is spread primarily by the blackledge tick, or known as the deer tick, in northeastern, mid-Atlantic, and north-central United States, and by the western blackledge tick in the Pacific Coast states. So Borrelia mayoni is rarely found in ticks and has only been detected in blackledge ticks in north-central United States area, so that one's rare. Blackleg ticks have 2 to 3 year life cycle. During this time, they go through 4 life stages, which includes the egg, larva, nymph, and adult. After the egg hatches, the larva and the nymph each must take a blood meal to develop to the next life stage. And obviously, the female as well needs to take a blood meal to produce eggs. So the larval nymphal ticks can become infected with Lyme disease bacteria when feeding on an infective wildlife host, usually a rodent. The bacteria are passed along to the next life stage when they feed on this infected rodent or wildlife host. Nymphs or adult females can then spread the bacteria during their next blood meal, like I said. And deers are important sources of blood for tick and are important for the survival and movement across or other areas so they can spread and live. But they are not infected with Lyme disease bacteria and do not infect ticks. Most people think that Lyme disease comes from deer, but they do not get infected. They just are where most ticks survive on. So in most cases, a tick must be attached for 36 to 48 hours or more before the Lyme bacteria can be transmitted. So if you remove a tick quite quickly, within like 24 hours, you can reduce the risk of getting this disease. And in eastern United States, where Lyme disease cases are most common, people may be bitten by blackledge ticks or deer ticks, mostly from spring through fall. Now I'll pass it on to Elizabeth. Oh, here's a quick image of what they look their 4 life stages. So as you can see how small they are compared to the dime on the right. And now Elizabeth will take over.
Thank you, Karla. So I'm going to discuss the signs and symptoms. And the most notorious sign is the bullseye rash, and it's not necessarily shown in everyone, and it can go unnoticed. And for the early stage of the disease, you'll see rashes, fever, headaches, chills. And for untreated disease where it'll progress for months or years, it then becomes a little bit more difficult to treat and it might not be able to be treated. And then it can be fatal, arthritis, as you can see in the image below, nerve pain, cardiac arrhythmia, and Lyme neuroblastosis. And then you'll see palsy where the facial will droop. And we move on to the next. Karla. Thank you. And for statistics, based on insurance records, about 476,000 Americans are diagnosed with and treated for Lyme disease, Lyme disease is more common in children than adults, but in adults, it's typically middle-aged, white, and college-educated individuals, and it is slightly higher chance for men to develop it over female. And in this image, you'll see that, as Karla was saying before, that it's typically in the northeast and the south, but typically in northeast. And for diagnostic testing, to diagnose Lyme disease, there are several different factors and signs that the health provider needs to look to see. And first, we need to see if there's possibly an exposure to the black leg tick. And the CDC currently is recommending a two-step testing for the Lyme disease. So the first step, if it's a blood test, if it's tested positive or inconclusive, then they'll go on to a second test. And if that second test is positive, then you have Lyme disease. And overall, it needs to have 2 positive tests to be diagnosed. And then we will pass it on to Raquel for treatment.
Thank you, Elizabeth. Okay, so as far as treatment, the only known treatment for Lyme disease is antibiotics. And in most cases, recovery will be quicker and more complete the sooner treatment begins. And these antibiotics can be split into 3 categories. So the first category would be the standard treatment, which is just taking an antibiotic pill. And this treatment usually lasts anywhere from 10 to 14 days. However, the treatment may be a little longer depending on one's symptoms. So thus, it is still important to take all the pills as directed from your provider, even if you're feeling better. And then the second one is intravenous antibiotic, excuse me. And this is where a provider will prescribe an antibiotic given directly into the vein, just as the name says. And then this is usually used with more serious diseases, but especially if you have symptoms of long-lasting arthritis or any diseases affecting the nervous system or the heart. And then the last one, if providers provide a prescription, or excuse me, let me start over. If a provider prescribes an antibiotic as a preventative measure, this is, of course, known as prophylaxis. But this is only done strictly if the following 3 conditions apply, which is if the biting tick is known to be a deer tick, if you travel or live in an area where Lyme disease is very common, and then lastly, if the tick was attached to your skin for 36 hours or more. So again, antibiotics right now are the only proven treatment for Lyme disease. However, there are other treatments that maybe have not been tested yet or shown to work. So there might be more research on that coming soon. Thank you. So now let's talk about preventative care. So preventing Lyme disease takes thoughtful preparation and planning, and that's just because the key is to prevent ticks from actually getting onto your skin. So thus, when you go outside into areas where ticks can be found, it is helpful to do the following. So properly use an insect repellent. And of course, that's according to the manufacturer's instructions. And when in wooded or grassy areas, make sure to tuck in your pant legs into socks, wear long sleeve shirts and closed-toed shoes. Also wearing light colored clothes, and that's just so you could see the ticks easier if they are on you, so you can remove them. And then when you do return back inside, making sure to shower with a washcloth to remove any unattached ticks. And then lastly, making sure to examine yourself and any children's and pets for any ticks when heading back indoors. So again, the key is to remove any and all ticks from your body as soon as possible, and that will be the best way to prevent contracting Lyme disease. And right here on the right is a handy guide that you could take with you outdoors. You could put it in your backpack, and that's just to ensure you don't actually get Lyme disease. And then the last one, There was a recent finding that I found that I thought was very interesting. So this research was done with Johns Hopkins engineers, and they found how Borrelia burgdorferi, the bacteria that we've already mentioned, is the cause of Lyme disease, how that actually manages to migrate from the bite into a person's bloodstream. So this was done using a custom design, three-dimensional tissue engineered model. And they learned that the bacteria uses a tenacious kind of trial and error movement to find a way through openings, which are called junctions, which we've already learned about in the lining of the blood vessels near the original site of the bite. And this allows them to kind of hitch a ride down the bloodstream into the body and potentially affecting other tissues and organs in the body. And we do have a short clip. We're going to see if we can pull it up. We're just going to show about 10 seconds of it so you can actually see how this movement works. And Karla will play that here. So again, just as you see, oh, just go back a little bit, Karla, if you go back to 50 seconds. Oh, there we go. Thank you. So as you can see, the bacteria is kind of shifting back and forth here, and it's finding a way through. And you can see they are even navigating to different areas to try to make it through, and then they finally make it through. So that's an interesting finding that we found. So they figured out how they finally get in. And other than that, this is our references slide. And then, of course, thank you for your time. And if you have any questions, now's the time.